Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Types of psychosis and their causes. Psychosis is a break from reality characterized by delusions and hallucinations. There are several conditions classified as psychotic disorders, most notably schizophrenia, and others like major depression where psychosis is a complication rather than a feature of the disorder. It can also occur with a brain injury, substance abuse, and other causes. /r/n/r/n Approximately 3 of every 100 people will experience an episode of psychosis in their lifetime. Psychosis is not a condition on its own, but rather a symptom of a psychiatric or medical condition. /r/n/r/n Psychotic disorders and other mental disorders are diagnosed based on criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. Other causes may require blood tests and brain scans to determine the underlying cause. /r/n/r/n Follow the Flow. Getty Imagesrnrn Psychosis is the distortion of reality in which you have difficulty knowing what is real and what is not. It can be temporary, ongoing, or cause recurring symptoms. People experiencing psychosis have little or no awareness of their symptoms. /r/n/r/n Psychosis is characterized by two main features, /r/n/r/n These may be accompanied by two others that can help differentiate if the cause is psychiatric, medical, or substance-related. /r/n/r/n The manifestations of psychosis can vary by the individual as can the causes. /r/n/r/n A primary psychiatric cause of psychosis is classified in the DSM-5 as schizophrenia spectrum and other psychotic disorders. These are conditions in which psychosis is a defining feature of the disorder, rather than a symptom that may or may not occur. /r/n/r/n Psychotic disorders in this category include /r/n/r/n in people with schizophrenia and other psychotic disorders. Early signs may develop before a full-blown psychotic break occurs, such as /r/n/r/n By recognizing the early signs, you can seek treatment and potentially abort a serious psychotic episode. /r/n/r/n People with other mental disorders can sometimes experience psychosis as a complication of their condition. The difference is that people with these disorders may never have a psychotic episode, while people with psychotic disorders by definition do. /r/n/r/n These conditions include /r/n/r/n The diagnostic criteria for each of these disorders are individually described in the DSM-5. /r/n/r/n Psychosis is primarily associated with psychiatric conditions, but some medical conditions can also cause psychosis. This may be due to an injury or changes to the brain that cause a transient break or recurrent episodes. /r/n/r/n Examples include /r/n/r/n These and other medical conditions are listed in the DSM-5 as psychotic disorders due to another medical condition. With these conditions, hallucinations and/or delusions are the primary features. /r/n/r/n Certain psychoactive substances, both legal and illegal, can cause psychotic episodes either as a result of intoxication, prolonged use, or drug withdrawal. These episodes differ in that the person will often be aware of their psychotic break and experience suicidal thoughts or actions. /r/n/r/n Drugs known to induce psychosis include /r/n/r/n Psychosis caused by these and other drugs is classified in the DSM-5 as substance/medication-induced psychotic disorder. Under the DSM-5 definition, either hallucinations or delusions occur in the absence of catatonia or disorganized speech. /r/n/r/n All of the conditions associated with psychosis from schizophrenia to alcohol use are described in the DSM-5's definition of schizophrenia spectrum and other psychotic disorders. This is because the mind and brain are closely linked, and you can't necessarily isolate psychosis to one or the other. /r/n/r/n To this end, a clinician will want to investigate whether the appearance of psychosis is purely psychiatric, purely medical, or a combination of both. This may involve a battery lab and imaging tests to detect or exclude medical causes. /r/n/r/n Examples include /r/n/r/n Even if a psychiatric illness or substance use is suspected, these and other tests may be ordered to ensure that the diagnosis is correct and that an underlying or co-occurring condition is not involved. /r/n/r/n For instance, a severe urinary tract infection in an adult with dementia can trigger episodes of psychosis. Diagnosing this can direct the appropriate treatment. /r/n/r/n Sometimes, a person only has one psychotic episode. If the episode lasts longer than 1 day but is shorter than 1 month, it might be diagnosed as a brief psychotic disorder. /r/n/r/n Treatment for psychosis depends on the cause but may include medications, therapy, or both. In cases of substance use, detoxification may be the primary, or sole, form of treatment. /r/n/r/n Even if the cause is medical, antipsychotic drugs may be prescribed to help bring symptoms under control. With schizophrenia and other psychiatric conditions, the drugs can not only treat acute episodes but prevent recurrence. /r/n/r/n These include first-generation typical antipsychotics like /r/n/r/n Second-generation atypical antipsychotics may also be used. /r/n/r/n Generally speaking, typical antipsychotics are suited for both the treatment of acute psychosis and the long-term management of psychotic disorders. Atypical antipsychotics are reserved for long-term management and tend to be less effective in treating hallucinations and delusions. /r/n/r/n People with schizophrenia and psychiatric conditions would also benefit from psychotherapy, most often in the form of cognitive behavior therapy, CBT, or dialectical behavioral therapy, DBT. /r/n/r/n Psychosis occurs when you lose touch with reality and experience hallucinations and/or delusions. It can be caused by psychiatric disorders like schizophrenia, major depression, bipolar disorder, and PTSD. It can also occur with medical conditions like dementia, stroke, encephalopathy, and psychoactive drugs. /r/n/r/n Antipsychotic drugs may be used to treat acute episodes and prevent recurrence in people with psychotic disorders. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.